Hi, welcome to Medicine. Today we will be interviewing Cypher. Okay, so what is your doctorate type or your education type?
Okay, well, I have my BSN, my Bachelor's of Science in Nursing. I do not have my doctorate, and I do have just about done with the master's.
Okay, what is your specialty?
Well, right now I'm teaching Introduction to Health Informatics. My master's was in health planning, or starting in health planning.
Where do you work?
Academies of Loudoun with Loudoun County Public Schools.
So, what was your education to become a medical professional?
Well, first I had the university I went to, they had a career ladder. For nursing, you would get your associate's degree. So I had my ADN and then I stepped right away into the bachelor's program, BSN.
Oh, that sounds good. What was your motivation to choose your specialty or area of medicine?
Well, I chose nursing when I was younger first, because I loved caring for people. I loved taking care of patients, the technical aspect as well, but a large part of nursing, I would say more than 50%, almost 75, was patient education. So then I continued working as a nurse, but then with my love of education, I was then able to teach first practical nursing and now high school with health inform or introduction to health and medical science.
All right. What was your motivation for teaching, for joining teaching?
I just loved the teaching aspect of it. I do love the technical part, the emergency end of things, but there's so much to maintaining health that you need the patient's awareness and the education part. So then I like the teaching of the high school students so they can just see the greater picture of that. And uh, just I want to give them everything they can so they can get a good start into the medical field.
Mm-hmm. Walk us through a typical day as being a nurse or a teacher, or both if you would like.
Okay, well, okay, so a typical day of teaching. So I start the day. We have a lot of meetings being a school teacher, lots of meetings. Some of them are related to the school itself as staff member, but we also have a team, health and medical science, and we have a couple meetings a week with that so that we can work together on some things also for our student groups, how to manage them effectively. And then we start our day with the students, go through our day, didactic, labs, discussions, and try and plan in between all that.
Mm-hmm.
And that's it.
That sounds like fun, but it also sounds like a lot of work too.
Yeah, fun and work. Absolutely. But that's the way to go.
Yeah. Um, what are the pros of your job?
Well, as an educator, the pros are that we get to share it with the younger people, and then education too. uh, it is, and again, since I love the education, it's easy to fall into that role. But it one of the pros also is to be realistic. I'm not doing the 12-hour shifts that
Mm-hmm.
and different hours, so the stress is different, but you can maintain, if you're in charge of the family, I can maintain that a little bit better, not having the 12-hour shifts or nights and all that.
Mm-hmm. And on the opposite end, what would be some cons of your job?
Um, well, missing out on maybe the practicing of some of the patient contact. I had that in all the first 10 years of teaching because I taught nursing. So I was able to be at the clinical end of things. I
Mm-hmm.
would bring the students to the facilities. This is the first year I haven't had that, but it's going okay. I get to teach the students, and I just know the end product, how I hope I am making an impact so that when they have patient contact, they'll have a smile on their face, they'll be respectful and show absolute dignity to the patients that they'll be treating.
Yeah. Do you have an experience that changed your mindset about your career or in your career?
Well, I went back and forth. I jumped around quite a bit, and I tell the students that life can change with one breath. From you go to bed, wake up, and life can be different. But if I were to have stayed, I loved the education component, so I steered my nursing jobs into where there was a lot of teaching. Um, but so I stayed with that. And then as time wore on, I think if I were to go back, I would like emergency care.
Mhm,
That's a little more exciting, and um, you just get to do so many different things. But not any particular thing changed my mindset. It was, I think, over time.
mhm.
People they change depending on life experiences. And there was never one thing where, the bell went off and said, oh, I want to do this. It kind of grew with each position I was in.
That makes sense. So what kind of person would you recommend the job of nursing for?
For nursing, well, to have empathy, to care for people, to have patience, to see the whole picture, to not think everyone is the same, and they need to be able to treat people with respect
That's true.
and
We
love medical stuff.
Oh, yeah, for sure. Um, I know you kind of touched on this, a while ago, but do you have any particular tips for high schoolers in general to be a medical professional or to be a nurse?
Well, not to be afraid of if they're thinking, oh, I don't like blood, I don't like this, I don't like that. Uh, but people change, and what you're exposed to changes you. But first of all, not to be afraid. First of all, to listen to whether it be parents or guardians, find a mentor, and also don't be afraid to investigate. If you're thinking of, gosh, that sounds really good, um, talk to people, volunteer, and see as many different things as you can. And don't be afraid to try and think, I'm not good enough. That there's so many windows, you got to walk through the doors too.
That that sounds really good. And that was it for the interview. Thank you so much, Miss Cypher.